Arthritis isn't one disease, it's an umbrella for 100+ conditions that inflame and damage joints. But early diagnosis and the right plan can dramatically reduce pain, protect joints, and keep life moving. In this video, what arthritis is, the most common types, red flag symptoms, how doctors diagnose it, proven treatments, daily recovery strategies, and prevention tips to protect joints for the long haul. What is arthritis? Arthritis means inflammation in one or more joints causing pain, stiffness, swelling, warmth, and reduced range of motion. The two most common forms are osteoarthritis, degenerative, and rheumatoid arthritis, autoimmune. Beyond joints, some inflammatory types can affect eyes, skin, tendons, heart, lungs, and metabolism. So a whole person approach matters. Types at a glance: osteoarthritis, OA, wear and repair imbalance of cartilage and bone with age, prior injury, or biomechanics. Often affects knees, hips, hands, and spine, with pain that worsens later in the day and after load. Rheumatoid arthritis, RA, autoimmune attack on synovium causing symmetric small joint pain, prolonged morning stiffness, swelling, and potential organ involvement. Requires early disease-modifying therapy. Gout, uric acid crystal arthritis with sudden, severe flares, often big toe, midfoot, ankle, triggered by high uric acid, certain foods, alcohol, dehydration, or medications. Preventable with urate-lowering therapy. Spondyloarthritis, ankylosing spondylitis, inflammation where tendons, ligaments attach to bone, and physes, with back pain worse at night and morning stiffness, may involve eyes and bowel. Benefits from targeted biologics and movement. Psoriatic arthritis, inflammatory arthritis associated with psoriasis, nail pitting, dactylitis, sausage digits, and fasciitis. Early treatment preserves function. Fibromyalgia, related condition, chronic widespread pain, fatigue, and sleep disturbance without joint damage. Treated with education, graded activity, sleep optimization, and targeted meds. Red flag symptoms: sudden, intensely painful red-hot joint, possible septic arthritis or gout. New severe back pain with fever or neurological symptoms, rapidly progressive weakness or numbness, or unexplained weight loss and night sweats. Persistent joint swelling and morning stiffness greater than 30 to 60 minutes suggest inflammatory arthritis needing early specialist assessment to prevent permanent damage. Why early diagnosis matters in inflammatory arthritis. The first 3 to 6 months is a window of opportunity where prompt disease-modifying treatment can halt damage, preserve work capacity, and reduce long-term disability. In OA, targeted early care improves pain, restores function, and may delay or avoid surgery with weight management, strength, and joint load optimization. How doctors diagnose history and exam. Pattern of joints, stiffness timing, swelling, flares, injuries, skin nail changes, eye symptoms, bowel symptoms, and family history. Tests: blood work, ESR, CRP inflammation, rheumatoid factor, anti-CCP for RA, uric acid for gout, joint aspiration for crystals or infection, and imaging X-ray for joint space loss, osteophytes. Ultrasound, MRI for synovitis or early changes. Treatment overview by type: osteoarthritis. Core: education, weight optimization, strength training, especially quadriceps hip, aerobic activity, joint-friendly movement, footwear orthoses, and heat-cold. Medications: topical NSAIDs for hands, knees, oral NSAID short courses as needed. Acetaminophen for some. Duloxetine for chronic OA pain. Cautious use of injections, for example, steroid for short-term relief. Procedures: when severe functional loss persists, consider joint-preserving procedures or arthroplasty, for example, knee-hip replacement after conservative care. Rheumatoid and other inflammatory arthritis. Disease-modifying anti-rheumatic drugs, DMARDs, methotrexate is a common anchor. Alternatives include leflunomide, sulfasalazine, hydroxychloroquine. Biologics, targeted therapies, TNF, IL-6, IL-17, IL-12/23 inhibitors. JAK inhibitors chosen based on disease pattern, comorbidities, and safety profile. Bridge therapy, short courses of glucocorticoids may control flares while DMARDs take effect. Aim to minimize steroids long-term. Gout. Acute flare, NSAIDs, colchicine, or corticosteroids. Start early. Long-term, urate-lowering therapy, allopurinol, febuxostat, to target serum urate less than 6 mg DL5 interfacious disease. Lifestyle supports hydration, limiting alcohol, especially beer or spirits, and moderating purine-rich foods. Spondyloarthritis. Exercise and posture programs, NSAIDs, and escalation to biologics, TNF or IL-17 inhibitors, based on activity and imaging. Psoriatic arthritis. Tailored therapy by domain, peripheral joints, skin, nails, axial and fasciitis. Dactylitis, including methotrexate and biologics, TNF, IL-17, IL-23. Fibromyalgia. Education, sleep hygiene, graded aerobic strength training, CBT-informed strategies, and selected meds, for example. SNR is pregabalin as needed. Self-care and recovery strategies, 150 minutes, week moderate aerobic activity plus 2 strength sessions focusing on major muscle groups and joint-stabilizing muscles. Include mobility and balance work. Pain pacing, alternate activity, rest, use heat before movement and ice after flares. Keep a flare plan with dose-timed medications and recovery days. Weight and nutrition, even 5 to 10% weight loss can reduce knee-hip OA pain substantially. Emphasize anti-inflammatory patterns with fiber, lean protein, omega-3 south, and minimal ultra-processed foods. Sleep and stress. Consistent sleep window, wind-down routine, mindfulness, breathing exercises. Stress worsens pain sensitivity and flare frequency. Assistive tools, braces, canes, jar openers, raised toilet seats, ergonomic keyboards, and shock-absorbing shoes to reduce joint load and maintain independence. When to escalate care: pain or swelling that persists beyond 2 to 4 weeks of home care. Repeated flares, new joint deformity, systemic symptoms, fever, malaise, or side effects from medicines warrant medical reassessment. Ask about referral to rheumatology, physical therapy, occupational therapy, podiatry, or pain specialists for comprehensive management. Preventing progression and flares: keep inflammation low with adherence to prescribed DMMI, AODs, biologics. Don't stop meds abruptly after feeling better. Address flare triggers: infections, abrupt overuse, poor sleep, unmanaged stress, or lapses in therapy. Keep vaccinations current per clinical guidance. Simple 6-week starter plan, weeks 1 to 2. Daily 20 to 30 minutes low-impact cardio, walking, cycling, swimming. Add heat before, ice after. Start a symptom, meds, activity log. Weeks 3 to 4. Add 2 25-minute strength sessions, week, hips, quads, hamstrings, calves, core, shoulders. Start gentle mobility routine morning and evening. Weeks 5 to 6. Progress cardio by 10 to 15% weekly if tolerated. Trial Tai Chi or yoga once weekly. Refine sleep hygiene. Review pain plan and medication timing with a clinician. Myth-busting quick hits: exercise wears out joints. Truth: appropriate, joint-smart exercise reduces pain and preserves cartilage and strength. If X-ray is normal, pain isn't real. Truth: early inflammatory change may not show on X-ray. Clinical exam and ultrasound, MRI often clarify. Steroids are the only fix. Truth: they're short-term tools. Long-term control comes from DMI, RD, biologics, therapy, and sustainable habits. Book evaluation for persistent joint pain, swelling, or morning stiffness greater than 30 to 60 minutes. Start a gentle movement and strength plan this week. Use heat, ice strategically. Discuss disease-modifying options if inflammatory arthritis is suspected. Don't delay. Adopt joint-friendly habits, weight management, sleep, stress care, and ergonomic tools. With the right diagnosis, modern therapies, and steady daily habits, arthritis pain can shrink, function can grow, and life can feel possible again, one step, one rep, one better day at a time. Motion is medicine. Small steps, strong joints, less pain, more life. Together, we move forward. If this helped, please like, share, and subscribe. Someone's relief journey may start with this video today.